Hello, everyone. Thank you so much for joining us at Jamf today. Today, we're here to talk about a solution we are offering that is helping healthcare organizations globally with Apple technology during the pandemic, virtual visits powered by Jamf. With us today is Alberta Health Services to share how they are using it and their results. My name is Kat Garbus. I'm a Senior Strategic Evangelist at Jamf, supporting partners and organizations in the enterprise. With me today are my wonderful colleagues on the healthcare team, Kelly, Tyler, and Tim. Kelly and Tyler are our business development executives, and Tim Knox is our technical resource and one of the virtual visit developers. Before we dive into today's session, here's a real quick overview of our agenda. For those who are new and working with us, or we haven't had the pleasure of working with you yet, we're going to do a quick overview of Jamf. Then we're going to dive right into today's session and hear from our guest, Mike, Alberta Health, and Tim will walk us through a technical review of how this all comes together. Then we'll have time at the end for Q&A. So a little about us. Jamf was founded 18 years ago with one goal: to empower people through technology. We focus exclusively on supporting Apple technology, and by Jamf focusing only on Apple, this allows our customers to have best-in-class support, more MDM features that speak directly to the Apple platform, and has ultimately given us a 96% customer retention rate. And this is our overall product portfolio. We have Jamf Now supporting small, medium business markets. Jamf School is our management solution for education. And of course, Jamf Pro, our MDM solution, which is the #1 rated MDM for Apple management. Alongside it now are Jamf Protect for endpoint security and Jamf Connect for identity management and security. Then at the very bottom, we have Jamf Nation, which is our online community for Apple admins. It's free to join, you don't have to be a customer, and it's a great mind share. In a nutshell, we are here to help support you and your Apple devices in many areas beyond management. And at Jamf, we help a lot of people. More than 40,000 organizations rely on us each day to help manage over 16 million Apple devices and counting globally. Being the world leader in Apple management, we're supporting from small businesses, governments, all the way up to the enterprise. We have workflows to support organizations of any size, regardless of their Apple footprint. So we can help whether you have 5 devices or 5,000. And if we zoom into healthcare, Jamf has dedicated so much focus on healthcare, especially since 2015. And we are supporting 8 of the top 10 US children's hospitals and 15 of the top 20 adult hospitals in the USA. To share with us more about our approach to healthcare and provide an overview is my colleague, Tyler. Tyler, feel free to take it from here.
Yeah, definitely. Thank you very much, Kat. As Kat alluded to, Jamf has made a concerted effort in the healthcare space now for over 5 years, and we built our first healthcare-specific product back in 2017. All of our solutions in healthcare have one thing in mind, and that's putting the patient first. So whether we're directly supporting the patient by enabling them with technology to enhance their experience in the hospital, or we're supporting the clinician with technology that makes it easy to use so that they can spend more quality time with their patients, we have the patient in mind. The solutions that we've built out to support healthcare are centered around 3 areas: patient experience, clinical communications, and telehealth. The first solution, patient experience, we built back in 2017 with a unique integration that we have called Jamf Healthcare Listener. Jamf Healthcare Listener talks to your electronic medical record system and allows you to take action on devices so that you can either remotely wipe that device or support your patients in other workflows. We have this deployed all over the world with many types of integrations, things like ensuring that there's integration with Apple TV or room controls, and centering around ensuring that your patient's data when they leave the hospital is wiped from that device and that it's configured for that next patient when the patient comes into the bedroom. On the clinical communication side, we partner with application makers like PatientSafe, who have purpose-built healthcare applications for your clinicians to communicate with each other. And we built out a specific application or set of applications, Jamf Setup and Reset, to support the various workflows that hospitals are looking to use to support clinical communications initiatives. So whether you're looking to set this up for a couple of nurses in a single hospital system, or roll this out to thousands of clinicians across a multi-hospital organization, we can ensure that that device is set up for that clinician on the device itself. So when they start their shift, they can set their own device up. And that when there's a shift change, that device can be reset for the next clinician. And finally, virtual visits. Jamf has been in virtual visits now for a couple of years. Initially, we were doing remote patient monitoring with a partner of ours, Locus, for pediatric patients in the home. When COVID hit, we had many of our hospitals reach out to us asking us to help with a solution to help them with two issues that they were having: starting meetings for patient to family and for provider to patient. On the patient to family side, they wanted a solution that would allow the meeting to be really easy for the patient to start with their family, that would help reduce social isolation, and then it will allow for the family then to have to be able to connect with their care team. On the provider to patient side, they wanted it to be easy to use so that the provider could know who they're meeting with and start that meeting remotely. And they wanted to reduce the amount of contact and the amount of PPE, personal protective equipment, that they were consuming. I'm very excited today to introduce Mike Zingeler, Provincial Manager of Patient and Public Services with Alberta Health, to talk to us further about the solution and working with Jamf. He was one of the first people to do this with us.
Hi, this is Mike Zingeler, and I'm, like Tyler mentioned, Provincial Manager for Patient and Public Services. And what that really means is I've been responsible for more of the entertainment side of the business, so all the televisions in the province. And I'll give you a little bit of background. First, we'll go through who Alberta Health Services is, because I believe there's some folks here from Canada, but there's a bunch of folks not from Canada. So maybe So Alberta Health Services is located in Alberta, Canada. And we're Canada's largest fully integrated health system with over 102,000 employees. We serve the entire population of 4.3 million people. We have 8,400 physicians, about 8,400 acute beds, as well as 27,000 long-term beds. There's a bunch of other stats that if you're interested, you could just go on our website and have a look at. But we're basically across the entire province, and we support anybody who walks through the door. So what I wanted to also do is talk a little bit about, before we get into the virtual visits, I just wanted to sort of give you a background of why I got introduced to Jamf. And we started off a couple of years ago trying to look at what we're going to do with our traditional TV service. And I know this is taking it from a way out, but you'll get there in a second. So we have the TV services, and we've got across the province 30,000 some TVs. And we know that we're in jeopardy of having an outdated system. So we started looking at what we could replace that with. So we've been doing a lot of work. We've done some surveys and some research. And we've come to the conclusion that a bedside tablet is probably the best solution to provide not only a better patient experience, but reduce costs and provide a platform for growing further out from there with other capabilities. So one of the things we wanted to do is last year we were looking to do a proof of concept, and we started looking at what are the things that we have to do if we're going to hand a patient a device. What are some of the things that we absolutely must do? And number 1 and 2 are we have to be able to physically sterilize a device as well as digitally sterilize a device. And we started talking to our current MDM provider, and unfortunately they didn't have anything that did that. And we discovered through some research that Jamf actually had this reset button that Tyler had mentioned earlier. So we started looking into that. As a matter of fact, we actually gave our MDM provider a link to Jamf's website and said, hey, guys, check this out. This is what we want. Unfortunately, they couldn't provide it. So we contacted Jamf, and we worked through some details with them. And we started last, it's probably 10 months ago, we started dealing with Jamf with regards to a proof of concept. And in December of last year, we started with 1 site, and we expanded that to 2 sites in Alberta, 2 units, where we placed tablets at the bedside. This was going great until COVID happened. And then as soon as COVID happened, this is where we get into the virtual visits, is that we knew that some of the folks that were patients that were in our units that we were trialing this out needed to be able to contact their families because the restrictions for visitation had got to the point where nobody could come and visit them. And we had a lot of need for this. And so we turned on Zoom just as a basic app on the remotely onto these units. And the patients were overwhelmingly excited about this, the fact that they could now contact their families and talk to them without having to come in. And this turned into something even bigger because all of a sudden this sort of started grabbing a little bit of traction. And we ended up going across the entire province and started looking and saying, other sites need this, obviously. How are we going to do this? And that's when our friends at Jamf contacted us, and they knew what we were up against. And they said, well, listen, we've got this thing that you can try out if you're interested. And the virtual visits, and that's how that became sort of the project. So what we wanted to do, what the real problem was because the patients had no access to their family or friends, and this just wasn't just COVID patients, this was patients of all sorts. So anybody who was in the hospital, obviously, they couldn't visit their families. And so what we wanted to do is provide a way for patients to contact their families, and it has to be easy to use. And that was one of the struggles we had with just putting on different apps, communication apps, is that they're not always easy to use, and especially depending on the patient's condition. And we can't really count on the frontline staff to really be technical experts. So we needed something that was very easy to accomplish and make work. So that's when we started looking at the solution, which is basically the Jamf virtual visits. I think you can go to the next slide. And you're going to get some views of what this looks like. But we took this solution that they gave us, and quite frankly, it took us maybe 2 weeks to sort of get it through the system to work through any sort of issues that we had. And it was mostly ours. And we ended up putting them on over 550 iPads distributed across 100 sites. And these were shared, and they're used for visitation as well as virtual goodbyes. And we configured all of those using only Jamf's virtual visits with Zoom. So we're extremely pleased with that. We pulled some stats off the other day. And if you look at the outcomes of this, so far we've had about 10,000 virtual visits to date, and over 100,000 minutes of people chatting with their families. So we're very excited about this. This is actually growing again because there's still need for restrictions. And even today, we shipped out another 30 iPads for different sites to get them to more virtual visits.
This was really great. Mike, thanks for taking time to walk through where you started. I think a lot of people can relate on the line that, the project changed, right? COVID abruptly came out of nowhere, and it's pretty amazing to see you were able to pivot and have a solution go out to your organization rather quickly. The outcome is pretty amazing to know that patients have the ability to have those virtual goodbyes, and on the same time with the staff as well, the staff doesn't have to worry about being technical, as you had mentioned. I have to ask, anyone come to mind, or any stories come to mind of any patients on this being really impactful?
Well, there's a whole bunch of stories. There's one that from one of the units. It's a neuro rehab unit at one of our larger hospitals in Calgary, and this guy, he was in there for, this is a longer term rehab unit. So he had been in there for months. He was trying to get a hold of family, and when we put the solution on his iPad, he was able to contact his father, who was actually he's in Nova Scotia, and he was in an end of life situation. But what was great about this is the sad part is he passed away, but he was able to talk to his dad before he passed. And so that was a really, really good news story for us, just to, we can't stop the inevitability, but we can certainly maybe try to make things easier for people. And that's really the goal and what we're able to achieve. So that was fantastic. I want to add one other thing too, is I don't think we would have been able to deliver this solution as quickly as we did. If anybody understands, and I think probably everybody's listening understands how slowly some things work, not only in healthcare, but because we're government run, things don't actually run very quickly. But the fact that we were already doing a proof of concept allowed us to turn this around in like almost days as opposed to weeks or months. So it was really quite a pleasant way of getting something done.
Mike, that's a really amazing story, and it's one of those things where you become so thankful for the technology, and I'm glad we were able to partner together on that. You had mentioned something that got me thinking. You had mentioned that this was part of the neuro unit. COVID has really been more for emergency care. Do you feel then for the immediate, it's being used for COVID, but do you think this could potentially even be repurposed for the long term in other areas then of Alberta?
Well, the visitation, yeah, actually, you know, it's interesting. The visitation piece, you thought about it before because people weren't able to contact their families and friends. But the visitation piece, not just for COVID, it's for anybody who's in a hospital that is not able to reach out. It's also for people that are in a facility that's not close to their home. So if the hospital happens to be 100 miles away and they can't visit their family, and even kids don't seem to want to go to the hospital and visit their family as well. So this is a way for them to have some FaceTime with them to actually talk and say, hey, how's it going? The other area that we've seen a real uplift on is in the long-term care. I just had a call today with one of our long-term care groups out of Edmonton, and they have a lot of people that, because the restrictions are being held in for the long-term care people, the residents there, they aren't able to see their families either. So this gives them, even when the restrictions are off, this gives them another way of visiting their families. And we've made it as easy as we could, I think, to, you know, just a couple button strokes and you're there to make a phone call or a video call to your friends.
Thank you for sharing that. I know we had been talking, and you've been talking to our organization prior to this with more of a different intention, but then it evolved. When it did become apparent, hey, we're going to do virtual visits, how long did it take for Alberta Health to get up and running with it?
Like I mentioned, I could look back at the calendar and check it out, but I remember we were approached by Adam, and he said, we've got the solution for you. And I think it took us about 2 days to get it up and running so we could test it. And then we had the first units implemented within another 3 or 4 days. And that was more us trying to get into the facility to make sure that people had the devices. So I would say, you know, if you're running Jamf, even if you're not running Jamf, it'd probably only take a week or two to get things really going if you've got everybody lined up for this.
That's great. Thank you. I'm glad we were able to get this up and running for you and Alberta Health so quickly. We're going to take a quick pause from questions and come back. We've got plenty of time for Q&A. I love that you walked us through your story. I think there are a lot of folks on the line curious how this all comes together. So what I'd like to do is have Tim, our solution engineer who's on the line. Tim, can you walk us through how this comes together on a technical perspective and what folks on the line can gather from how the technology works and how it could potentially work for them?
Yeah, absolutely. I can do that. I'm going to show two workflows here in a moment. I'm going to show the provider to patient room and the patient to communication out to their family or loved ones. One of which Mike has, and the other one Mike is hoping to get put in place pretty soon. So we want to be able to communicate from the providers into the patient's rooms without risking any sort of exposure. We want to reserve that PPE. And originally, when we were first putting this out, the idea was to flatten the curve of healthcare providers who were having to go into those rooms and reduce the number of contact points a patient and provider have with each other, and to make that as simple as possible. The other workflow that I'm going to talk about is the patient communicating out to loved ones, which is what Mike was talking about. Same exact reasons, to reduce that social isolation, to provide comfort during distress, and because being able to communicate outward to the family and the providers and the patient all at the same time so that we can all have the same information, we can all be up to date, all working remotely, and not being able to physically be in the same room with each other is pretty important. So I'm going to show you what that looks like. Okay, so this is my iPad. I'm going to pull it up right here. This is the one I have right in my hands right now. What it has on it is just a couple of things. I've got that reset app that brought Mike to the table early on. This is an app that we built that really just does what it says on the tin. It resets the device. Big red button allows you to wipe the device from the device. It's something that came out of our early efforts in healthcare that nurses were asking for a lot of reasons, partly to do maybe first level troubleshooting. Maybe they wanted just a way to wipe the device after a patient has used it. And it just digitally nukes the whole thing, wipes the device and reinstalls the operating system all from that single button. The other thing we have on here is this. This is virtual visits. This is what we're here talking about. And it does a few things. We tried to make it as simple as possible, as Mike said. The idea was, again, early on, our earliest conversations were with nurses who were saying, we don't want to have to use our personal devices to dial a patient's family so that they can spend the last few minutes of their lives with the loved one in the hospital. Nurses were holding up their iPhones to make that happen. So we wanted to make it as simple as possible for the nurses. They would create a new meeting link by hitting the top button. They would send an email out to the family members, or the patient could if they were in a position to be able to do that. Send that email out to the family members or loved one outside the hospital that they wanted to communicate with, and then start the meeting. A 1, 2, 3 process. I'm going to show you what that looks like live. So we're going to do some live cooking during a demo, which is always exciting. I have pre-populated Tyler's email because I cannot talk and type at the same time. I'm going to send him the email now. And it's going to give us some feedback here in a second that says the email was sent correctly, which it has been. We can customize all of this that's on the screen as well. That virtual visits up at that top, that could have, I believe does have, the Alberta Health Services logo on it, or insert your logo here. We can change the what's written in the message. We can change even the button that says send email to say something different. We can make this look like it's coming from your organization and make it look like it's branded for you. And after that email's been sent, and hopefully Tyler has got it, I'm going to click the start meeting button, which is going to open Zoom and actually open that meeting. And there I am. I'm going to join the video. And then in a moment, hopefully Tyler will be able to join that meeting. But you can see that what it did was start the meeting. And now I'm in the meeting. And anybody who has that link is able to join that meeting as well. Just like that. It's pretty darn cool. And it isn't any more complicated than that either. You can then hand that device to another patient if this is the only thing that's on the device. You can create a whole new meeting link, which destroys the previous link, and then send another email out to a different family member. That family member can join a meeting, and you just can rinse and repeat that as many times as you need. Okay, so the other side of this fence is the provider side. And this is something that we can and have provided to providers that they can access from any device that's within their hospital system. It's simply a URL that's looking at Jamf and grabbing some information from Jamf's inventory record and displaying it in a way that would make sense for your doctors and nurses and clinicians that are in your space. They could look up a room, say I want to communicate with room 101. I type in 101 in the search, and it's going to limit it, and reduce it down to just show the room that they want to talk to. They can click that start meeting button, which is the exact same start meeting button that's over here. They go to the same link. Or they could copy this and send it to maybe somebody who isn't part of their internal network, maybe a translator that you need to be able to communicate with your patient. You can send a link to them, and now they can join a meeting. And then the family member or the patient can send an email out to the family member, and now they have the same link. So now what we have is we have a provider who has a link to a meeting. We have a translator or somebody outside of your network that has a link. We have a family member who has a link, and we have a patient in a room that has a device that has a big green button that allows them to talk to all those people all at the same time. So you can have a big giant health consult without making it any more complicated than just having a big green go button, which I think is pretty cool. Okay, so let's talk about the back end a little bit, how it actually works. And this, I promise I'll be very, very high level. So how does this work? It begins at the beginning, a device that is not turned on. It's maybe a brand new device out of a box, or a device that has been wiped fresh, so it has a whole new operating system on it and it's just ready to be delivered. When it first powers on, it's going to talk to Jamf and become activated. And once it becomes activated, Jamf is going to start delivering the things it needs to secure it. Could be a wallpaper, it could be a bunch of restrictions, it could remove all of the default apps, and at the same time, deliver a new key, a new URL, a new web clip, which is the next chunk of this slide here, so that you can see right there the link that I showed you before. And now you have this nice flow where you can start the meeting. You've got a secure device. It all happens automatically. The patient doesn't have to do anything. It just gets all configured automatically through Jamf and through our web visit service. And then you can hand that hand that device to another patient. The nurse or the patient can click the new link button. Now they've got a whole new link. The previous link has been destroyed. There's all that security and safety, and you won't accidentally have a patient or a family member dialing into the wrong room because the previous stuff has been destroyed. Or you could use what Mike is using in his environment, which is the reset button. You could click the big red button, which would wipe the device, bring that whole new process from the very beginning, delivers the security, the wallpaper, the web clip, all that happens programmatically. And now you have a completely refreshed device. Really, really useful if you've got stuff on there that maybe isn't just virtual visits. Maybe you're an Epic shop and you're using MyChart Bedside and you want to be able to make sure you removed all that data, or you're putting multiple options on there. One of the things I really like about this, I'll talk about Healthcare Listener too. You could also do it programmatically with the Healthcare Listener. Tyler mentioned this early on, which is that first thing we built in our early days where it would listen for a discharge command from the nurse, which then triggers a wipe. So the nurse doesn't have to change anything they do. They click discharge when the patient is done. That Healthcare Listener hears that discharge command, wipes it, and then we start this whole process over again. Very useful, as I said, if you've got a lot of stuff on this device that you want to make sure gets wiped afterwards. If you want to give your patients the ability to do, well, anything, let them use the device as if it's their device. Or, which is really the case that I have found to be very impactful for patients around the world, is if they don't have technology like this, because not everybody does. Not everybody walks into a hospital completely kitted out with the newest technology that they can use to communicate with their loved ones. Maybe they simply need a device so they can talk to their family. And to be able to provide something like that for someone who doesn't have access to it, it's a pretty powerful thing to be able to provide to a patient who's in need or in distress or at the end of their life. What it does, create a new unique link every time we hit the button, or it wipes, whether that's done automatically through the Healthcare Listener or through Reset. We deploy all the accounts automatically. It allows the patients and families to establish a call, and we streamline everything, because what we really don't want to do is add more stuff to the nurse's plate. They've got a lot to do, and if we start adding technology on top of that list, nobody wins. So we want to make sure it is as easy as possible for everybody, the patient, the family, the nurse, the whole kit and caboodle. And it works with Microsoft Teams, and it works with Zoom, which is illustrated right here. Both workflows work fine with each. They work slightly differently on the back end, but what the patients experience, what the families experience, and what your Jamf administrators experience are all exactly the same. There's a little bit of a different setup for Microsoft Teams than Zoom, but both can be accomplished in the same amount of time we talked about with Mike. And there you have it. That's how that technology works.
Mike, I want to say thank you once again for joining us. Do you have any final thoughts or anything you'd like to part with before we close out for the day?
I don't think so. I just really enjoyed the relationship with Jamf. You guys are there and helping me out whenever I have an issue. So thank you.
We're very thankful for folks like Tim and Tyler and Kelly and the rest of our healthcare team to help support organizations like yours. So we are happy to help, and thank you, and you have a wonderful rest of your day.